But let's see where this is all going to take us and our health care in this country. Here now with a fair and balanced debate on where it all stands, Democratic Congressman Engel of New York and Republican Congressman John Shadegg of Arizona. Both are members of the Energy and Commerce Subcommittee on Health. Gentlemen, welcome. It's good to have both of you here. Representative Engel, if I may start with you, is your heart still in passing health care reform, and in what time frame?
Oh, very definitely. I mean, I'm for health care reform because I believe that we need to have health care reform. The current system is not sustainable financially. People have seen their premiums double and triple, and that will continue.
All right, but, we've seen the public response to this bill, and the public doesn't like this bill. So what are you going to offer them that they might like?
Well, I think there are certain things that everybody likes. I think that if people lose their jobs or change their jobs, they should be able to keep their insurance. I think that people don't want to be denied coverage for a so-called pre-existing condition. People don't want annual caps or lifetime caps where the insurance companies say, sorry, we've paid you all we're going to pay you. There's no reason why there should be these insurance companies should be exempt from antitrust laws. So I think there are certain things that we can pick out of the bill. Maybe a 2,000-page bill was too much for people to digest in one fell swoop. So I think there are things we can do. I hope we can do them in a bipartisan fashion because I think America needs health care reform.
All right. Well, you're talking about people being exempt from things. And Congressman Shadegg, one thing that people were not happy about at all, a lot of people in this country, and we saw it in all the polls, they weren't happy about the deals, the sweetheart deals that a couple of states got, Nebraska, Louisiana, for instance. They also weren't happy that union heads were able to walk into the White House and get a pretty good deal for themselves, too, that made them exempt from the caddy tax for quite some time. Are we going to see these kinds of deals disappear if we get any kind of compromise on health care?
Well, I certainly hope so. You're absolutely right. The American people do not want this bill. They've seen the sweetheart deals that were cut for Nebraska or Louisiana or, for that matter, the Northeast, and they oppose that kind of insider self-dealing by members of Congress, powerful members of Congress. And now, toward the end, there was a discussion of giving the unions a kind of a union carve-out where they'd tax all of the high-dollar plans or gold-plated plans for everybody in America except the gold-plated plans for union members. The American people are sick of that kind of smoke room dealing, and they oppose it. I do agree with Elliot that we can take this bill apart and do small pieces of it in ways that the American people can understand. And I think we can do that in a bipartisan fashion if the Democrats will agree. Pre-existing conditions, for example, is an issue on which we can come to an agreement, but not if, as they are currently threatening, they try to push it through reconciliation.
But Representative Engel, is there anybody who's saying, you know what, let's just throw this entire bill out? Let's start from scratch, because I think there is some, some momentum behind that idea. Because if you really throw it out and start from scratch, maybe you could talk about things like individuals having their own policy, and they take that policy from one place to another, or you could talk about real, true cross-border purchasing of health care. You could talk about tort reform. I mean, is that a better way to go, to say, start from square one? The president says we've got plenty of time.
Well, unfortunately, as John knows, things take a long, long time in Washington and to get done, unfortunately. And I don't think we have to throw the baby out with the bathwater. I think there are things in this bill that are good.
Yeah, but there's also so much stuff in that bill that is really annoying people. So, I mean, don't you think it might be a good, strong thing to say, to stand up as a congressman and say, out with this bill, let's start over?
I think that we know what needs to be reformed, and I think that, and it doesn't mean we only do health care. I mean, we need to tackle the economy, we need to do jobs, unemployment, there are education, there are lots of other things we need to do. I think the problem was that Congress seemed like it was so fixated on health care that we didn't seem as if we were doing anything else. That was a mistake, and I think we learned from the mistake. And again, I hope that in a bipartisan fashion we can reach out and we can get this done. The Republicans have been saying no to everything, and that's got to change. So maybe if we meet in the middle, we can both say yes.
Is that true, John Shadegg? Have you guys, you're not really reached out, or have you not been responding
to? No one reached out to us. There's no doubt about it. There was no attempt to make this a bipartisan bill. The president talked about reaching out, but he lent the job of writing the bill to the congressional Democrats, and they never let any Republican in the room. I think we can fix the problems in health care. We can take them apart and do them one at a time, and we can start paying attention, and I'm glad Elliot acknowledged this, to issues that are more important to the American people. The economy has to be number one. Jobs have to be number one. And there was, in fact, a complete consumption of the entire energy of the Congress just on health care and just on a very ideological bill that I don't think solved individual problems in the healthcare arena. I hope we can do that.
Maybe Congress should take the weekend and think about the deficit and the numbers that we had just come out and wonder whether or not we have any money to pay for any of this stuff. And maybe we need to start with the cross-the-board
spending cuts. That'd be a good idea.
The deficit started under Bush. Let's remember when Clinton left office, we had the largest surpluses in American history. So
that's all past history. We got to start fixing what we got to fix today.
Just looking backward, Elliot.
We learned for the future by not doing the mistakes of the past.
Excuses won't get you reelected, Elliot. You got to do the job you're elected to do.
Thank you very much,
I do,
gentlemen.
John, believe me.
Representative Engel and Representative Shadegg, good to have both of you here. Have a great weekend, folks.